Macrovascular complications of diabetes. Three major macrovascular complications of diabetes include coronary artery disease in the form of myocardial infarction, acute coronary syndrome, cerebrovascular disease in the form of stroke, peripheral vascular disease in the form of diabetic foot. Here are some facts. The risk of a diabetic patient having a stroke is twice as likely as the normal non-diabetic individual. The risk of a diabetic patient having a heart attack is nearly 5-fold higher compared to a non-diabetic individual. A 1% increase in HbA1c increases the risk of myocardial infarction by 14%. 75% of patients with diabetes die from cardiovascular disease. Atherosclerosis. Atherosclerosis is the mechanism responsible for the development of macrovascular disease. It is a process which leads to narrowing of blood vessels. Process of atherosclerosis. Cholesterol and fats build up inside the arterial wall. Chemical reactions cause oxidation of these lipids. This triggers the endothelial cells lining the wall of the arteries to release chemicals which signal monocyte activity. Monocytes infiltrate the damaged area of the arterial wall. Sensing the presence of oxidized lipids, the monocytes convert to macrophages. The macrophages then consume the deposits of oxidized lipids. This process causes the macrophages to change into foam cells. Build-up of foam cells leads to the formation of plaque. The accumulation of plaque causes the arterial wall to thicken and harden. The smooth muscle cells of the arterial wall then begin to multiply. These smooth muscle cells travel to the surface of the plaque. As they cover the plaque, the smooth muscle cells form a fibrous cap. If the cap, which is covering the plaque, ruptures or erodes, particles of plaque will escape into the bloodstream. Once in the bloodstream, the particles of plaque will form a clot, reducing or completely blocking the flow of blood. What happens then? The tissue surrounding the blocked vessel will degrade or die as its supply of oxygen and nutrients is reduced. If the affected tissue is the heart or brain, this will result in a heart attack or a stroke. Risk factors for atherosclerosis include smoking, high blood pressure, obesity, high-fat diet, little exercise, and diabetes. Treating macrovascular complications. Targeting the risk factors will reduce the risk of macrovascular complications. The following is recommended: lowering blood pressure, improving lipid profile, anticoagulant agent, and smoking cessation. Reducing blood pressure. The UK PDS study found that lowering blood pressure in type 2 diabetes mellitus patients was associated with decreased cardiovascular events and mortality. There are blood pressure lowering drugs available. These include angiotensin-converting enzyme inhibitors or angiotensin receptor blockers, which block the renin-angiotensin system. ACE inhibitors and ARBs are contraindicated in pregnant patients. Calcium channel blockers to block calcium entry into the heart muscle. This reduces the force with which the heart pumps and thus lowers blood pressure. The American Diabetes Association recommend a blood pressure target of less than 130/80. Improving lipid profile. This aims to reduce total cholesterol, reduce low-density lipoproteins, increase high-density lipoproteins. Lipid-lowering drugs include statins. Statins reduce LDL in the blood. They are effective in preventing primary and secondary cardiovascular disease. They are most beneficial for diabetic patients with a history of cardiovascular disease. Statin therapy is recommended for diabetic patients over the age of 40 with one or more cardiovascular disease risk factors. Statin therapy is contraindicated for pregnant patients. Fibrates are also lipid-lowering agents. They reduce triglyceride concentration and raise HDL levels. The Veterans Affairs High-Density Lipoprotein Cholesterol Intervention Trial found that use of fibrates reduced the risk of myocardial infarction in diabetic patients. The American Diabetes Association recommendation for lipid target include LDL less than 100 or less than 70 in patients with obvious cardiovascular disease. HDL levels should be over 50. Fasting triglycerides should be less than 150. Overall, they recommend reducing the intake of saturated fats, trans fats, and cholesterol. Aspirin is recommended as an anticoagulant agent which prevents red blood cells from sticking together, consequently preventing clumps of blood cells from clotting and blocking blood vessels. The American Diabetes Association recommendations include for patients with an increased risk of cardiovascular disease, aspirin therapy is recommended. Aspirin is not recommended for diabetic patients with low CVD risk. For diabetic patients with a history of CVD, aspirin therapy should be recommended as secondary prevention. For patients with aspirin allergy, clopidogrel is an alternative which can be taken for a year after acute coronary syndrome. The antithrombotic trialist collaborators reviewed 6 large trials of aspirin. They found that aspirin reduced the risk of cardiovascular events by 12%. Smoking cessation. Patients with diabetes should be encouraged to stop smoking if they do smoke. Counseling is recommended to help patients quit smoking. Smokers with diabetes have an increased risk of cardiovascular disease and premature death. In summary, patients should do the following to reduce the risk of macrovascular complication. Lower your blood pressure through the use of angiotensin-converting enzyme inhibitors or angiotensin receptor blockers. Improve your lipid profile through good diet control and statin therapy. Use anticoagulant agents such as aspirin and also stop smoking.